Okay, so Emily, could you state your name and your title here at Fort Walton Beach Medical Center?
Yes. My name is M. Dewey, and I'm an ICU nurse here at Fort Walton Beach Medical Center since October.
And what kind of work do you do here, and what are your main responsibilities?
So as a nurse, I assess the patient every day and throughout the shift as any changes in their breathing or heart and other conditions, and inform the doctor and then enact the doctor's plan of care, whether it's medications or treatments, and try to coordinate that between the primary doctor, consults, and then any therapists who are also involved, from physical therapy, speech therapy, and all of our team.
Okay. What kind of precautions must you take to protect yourself from the virus while working with patients?
So there's always an expectation, even before all this, for good hand hygiene, making sure you're using sanitizer in and out of the patient's room before you put on gloves, when you change gloves. With the virus, we do have the N95 masks that we're using, especially in the ICU if there's what you'll hear people saying, aerosolized treatment, so a nebulizer, if we're doing a bronch to get a better look at their lungs, or if they're on a ventilator. And we still have masks and gowns and hair covers, so everything we need to protect from droplets that could come towards us.
Okay. Do you have any concerns about exposure?
I think there's a chance for exposure everywhere, like even in the community. You see people wearing gloves at the grocery store, and if you pick up a piece of fruit and put it back down, that's exposed to everyone. So I don't feel any higher risk here in the hospital than out in the community.
The work you are doing is heroic. How do you view your work during the pandemic compared to before the pandemic?
I think it takes a special person to work in healthcare at any level, from our environmental and culinary to the physicians to all members of our staff. So I think the pandemic has really brought out a sense of teamwork in all of that. And there's certainly an added level of stress or urgency, but I think you just see everyone continue to come together and work in all parts. You've got team members at every level helping to clean, and people stepping up and helping out.
So what inspires you and keeps you going now during this crisis?
So I'm inspired by all the good stories that you hear in communities that are stepping up and coming together, whether it's donating food and masks or helping neighbors. And me personally, my family and my husband have been really inspiring and supportive of me and all the work that I do, especially during this pandemic.